in the presence of pathology, they can be seen, they can be felt, and they manifest all kinds of problems. And the reason for this is exactly what we talked about before. The pathologies of the low connecting channel have to do with how do I come to terms with myself? How do I find the balance between the wood and the metal, between the hun and the po, between the aspirations of life, the imagination of what do I want to be and how do I want to develop, and on the other hand, the cold reality of metal and po, and boundaries and restrictions and responsibilities. Because neck pains in the clinic are always a challenge. Sometimes people come because their main complaint is neck pains, but many times people come for all kinds of different reasons. And during the course of the treatment, neck pains come up. And neck pains are a challenge because it's fairly simple to get a short-term relief or change in pain or in mobility when you treat neck pains. But it's much more difficult to get long-lasting cure, because many times with neck pains or with pain problems in general, especially that have to do with joints, and especially this kind of complex joints that we have in the neck, you can get a relief of pain and you can restore mobility. But even when things get better, usually they don't last for long, and people tend to come back with the same kind of complaints, and the problem is never really solved. The upright chi is we could say the correct chi, how things should be. So when we speak of the stability of the neck and of holding up the head, it's also giving us this uprightness, which is how things should be. And for the Chinese, how things should be has very much to do with this vertical axis connecting heaven and earth and giving us this verticality, which is the uniqueness of the human race, in that we are able to not only live out our lives, but we are able to think and we are able to come to conclusions and make decisions about what is the right way to live, what is the correct way, how do I find this correctness or uprightness within our lives. But because gallbladder 37 has to do with opening the vision, and opening the vision to this ability to see beyond the clear-cut reality that is our life, and to have a vision about what can be, what will be, what can be, to be optimistic, to have a brightness, to have a clarity about what can happen, what are options that we have in our lives. And in this instance, in this way of thinking, it's not so much, you don't need to go only according to the pulse. You can very much look at what we call the anatomy of the neck and what is the area that is involved, and choose the Jing River points according to this. Of course, if you know pulse diagnosis, you can also feel this on the pulse, because this has to do with the main channels. But you can definitely choose these points according to where is the area that is affected.